reporters are taking a deep dive into mental health. They will be telling you all about how mental health is being addressed across the state with a special focus on Southeast Ohio. Taylor Mondragon is joining us now to give us some national context and set up this week's content.
That's right, Emma. When taking a look at mental health, we need to recognize what factors impact it and what steps are being taken to provide resources. One of the major recent distinctions is life before and after 2020. Before the pandemic, the Kaiser Family Foundation found nearly 24% of Ohioans reported experiencing anxiety and depressive disorders. Today, that number has jumped to just over 33%, an almost 10% increase. We spoke to Dr. Christine Baugh, the newly elected president of the American Counseling Association, to understand this rise.
There's more awareness these days, so people don't necessarily suffer in silence, but they speak up about some of the symptoms that they're having. But we can't ignore the fact that COVID has altered the way we view the world and has altered our relationships fundamentally.
Alongside the negative impact of the pandemic, the increasing awareness of mental illness symptoms allows for additional and improved treatment options. Dr. Jay Fournier, the director of Mood and Anxiety Program at the Ohio State University Wexner Medical Center, says awareness surrounding mental health is because people are beginning to feel more comfortable talking about their problems on social media.
Are feeling comfortable disclosing some struggles that they have experienced through social media.
Fournier says through social media has helped create awareness around mental illness. The past 3 years, along with social media, has increased mental health problems.
At the same time, I think there are challenges to social media use. The research is showing that that's true, that it's linked to increased depression and anxiety, particularly in young people.
Even with this increased awareness, Baugh and Fournier says it's not enough. Unfortunately, they both recognize mental health resources aren't accessible to everyone because of insurance issues and the lack of care in parts of the state.
Where we are in Appalachia, I think that we are really struggling to meet the demand of qualified mental health practitioners.
However, new governmental bills aim to remedy this. On a federal level, a new bill called the Mental Health Access Improvement Act is allowing those on Medicare to receive the mental health services they need. And back at home in Ohio, Governor Mike DeWine is allocating part of his newly proposed budget towards mental health care.
Let's not accept that mental illness and addiction are inevitable, or that some of these illnesses can't be prevented. This and other research opportunities will help us launch new discoveries about the brain and about resilience. It will help us understand the unique nature of mental health issues across Ohio's urban, suburban, rural, and Appalachian communities.
Baugh and Fournier hope DeWine's budget will help bring resources to Appalachia and across the state.
The hope is that we leverage that and continue to put resources behind, various models and various ways of doing remote mental health care. Because it's just true that not everybody lives near Columbus, right? Not everybody lives near a large, medical institution.
We know what our bodies need, and when it comes to our mental health, it is no different. She says 2 of the best ways to prevent mental illness is to hang out with loved ones or going outside just for 30 minutes.
Taylor, thank you so much for the insight. If you are struggling with mental health, call or text 988 or contact your local provider. Ohio University students can connect with counseling and psychological services online or on the phone.
We'll have more stories on mental health all week. You can listen to The Outlet on Spotify, SoundCloud, and Apple Music for in-depth interviews with the reporters. And for even more information, you can read written content at woub.org.